Hello everyone, this is the continuation of video series on biochemistry case studies, and today we are going to discuss case study on Balagra. So before going in the detail, if you want to download lecture notes, if you want to give online quiz, and if you want to have one-to-one interaction with the faculty, then download the Nexus app. Link for the downloading the app is given in the description. So let's start. So the case description is 35-year-old poor farmer on irregular diet presents with the history of frequent diarrhea and dry scaly lesions around the neck for past 2 months. On examination, he was found to have characteristic lesions around the neck and dorsum of the hand. Lesions were itchy, especially on exposure to the sun. He grows maize and gives the history of excess maize consumption for the past 10 years. So that is the description. And along with the description, these are the some images which are given for the case. Fine. So in the case, you can see there is a presence of dry, itchy, scaly lesions on the dorsum of the hand. There is also presence of hyperpigmentation around the neck area. Fine. So now let's see the questions of this case study. The first question is, what is the diagnosis in above case? Name the vitamin deficiency which may be associated with above symptoms. So from the description, we can have idea that patient is having diarrhea. There is also presence of dry, itchy, scaly lesions around the neck and dorsum of the hands. And another hint which is given in the description is patient is consuming maize from the last 10 years. So from all these hints, we can say that patient is having pellagra which occurs due to the deficiency of niacin, which is a vitamin B3. And this pellagra is characterized by 3Ds, that is diarrhea, dermatitis and dementia. So this is the case of pellagra which occurs due to the deficiency of vitamin D3 and it is characterized by 3Ds, that is diarrhea, dermatitis and dementia. So that is the answer of the first question. Second question is, what is the name given to the characteristic lesion observed around the neck and on hand of the individual? So the characteristic lesion which is observed around the neck is known as a Cagel's necklace. Fine, it is known as a Cagel's necklace, and the dry, itchy erythematous scaly lesions on the hand is known as a closed hand dermatitis. So this is the picture which is showing the dry, itchy erythematous skin lesions seen on the dorsum of the hand, which is known as the closed hand dermatitis, and this is the hyperpigmentation which is seen around the neck. And this erythematous skin lesions have a characteristic feature that they are bilateral and symmetrical, and they affect mostly the sun exposed part. Fine, and they are photosensitive. So that is regarding the skin lesions which is seen dorsum of the hand, which is known as the closed hand dermatitis, and the lesion which is seen around the neck is known as a Cagel's necklace. Third question is, which amino acid may synthesize nicotinic acid in vivo in the cell? So one amino acid, it helps in the synthesis of vitamin B3, that is niacin, is the tryptophan via kynurenine pathway, and the enzyme required for the kynurenine pathway is kynureninase. Fine, so that is the answer. Tryptophan is an amino acid which may produce nicotinic acid in a vitamin B3 requiring pathway known as a kynurenine pathway, and tryptophan is abundantly found in legumes, fish and meat. And this kynureninase enzyme require PLP. PLP is the active coenzyme of vitamin B6. Fine. And 60 milligram of tryptophan give rise to the 1 milligram of niacin. So that is the answer of this question. Fourth question is the dependency of maize as a staple diet may be cause of this presentation? If yes, then why? Yes, if the patient is having on the staple diet, that is maize, maize contain very low amount of tryptophan. Fine, it contains very low amount of tryptophan, so there will be very less conversion of tryptophan to the niacin. And maize also contain niacin, but niacin is present in the bound form, which is known as a niacetate. hence it is not available for the absorption. So that is the reason for the deficiency of vitamin B3. Along with the maize, if the person is having staple diet as a juar, fine, juar or sorghum, then this juar or sorghum, it contains high amount of the leucine, and this leucine will also inhibit the conversion of tryptophan to the niacin via kynurenine pathway. Fine, hence it reduces the production of niacin. So, and pellagra which occurs due to the consumption of this juar is known as the leucine pellagra because it contains high amount of the leucine. That is the answer of this fourth question. The fifth question is, enlist the causes or conditions when patient may have pellagra or pellagra-like features. So the one condition we have already seen, that is niacin deficiency, vitamin B3 deficiency. Then second condition is if the staple diet is maize or corn. Third condition, if the staple diet is the juar or sorghum. Fourth condition is if there is a deficiency of vitamin B6, that is PLP deficiency, so the kynureninase enzyme will not be able to convert tryptophan to the niacin. And fifth is the Hartnup disease. These are the causes of pellagra or pellagra-like features. The last question is, what is the treatment of this disease? So the treatment of this disease is the oral supplementation of vitamin B3 in the dose of 30 milligram twice daily. So that is the treatment of pellagra, which occurs due to the deficiency of vitamin B3, which is also known as the niacin. Thank you for watching. Thank you.